Under the Needle, where acupuncture meets anatomy. Today, we're exploring lung 9, one of the most commonly used points in clinical practice. Lung 9, or Taiyuan, is located on the radial side of the wrist crease in a depression just lateral to the radial artery. This point lies directly over one of the most clinically important neurovascular regions of the wrist. The location serves as a transition zone between the forearm and hand where tendons, vessels, and sensory structures converge. Because of its anatomical relationships, lung 9 is closely associated with both wrist function and vascular regulation. The most notable structure beneath lung 9 is the radial artery, which travels superficially through this region before contributing to the deep palmar arch. Nearby lies the tendon of Flexor carpi radialis, an important stabilizer of wrist flexion and radial deviation. The palmar carpal ligament contributes to wrist stability and force transmission. Although not directly beneath the point, the median nerve travels nearby and contributes to sensory and motor function throughout the hand. Together, these structures create an important interface between vascular, neural, and musculoskeletal systems. Clinically, lung 9 is frequently used for wrist dysfunction and conditions involving repetitive hand use. Because of its proximity to major vascular structures, it is often discussed in relation to circulation and tissue perfusion. The region also influences fine motor control through its relationship with wrist stabilization and hand mechanics. For clinicians, lung 9 represents an important example of how vascular and musculoskeletal anatomy intersect. In traditional Chinese medicine, lung 9 is known as the Yuan-Source point of the lung channel and the influential point of the vessels. It is commonly used to regulate circulation and support respiratory function. From an anatomical perspective, lung 9 sits directly adjacent to the radial artery and important wrist stabilizing structures. The point occupies a unique location where vascular, connective tissue, and motor systems converge. When these perspectives are integrated, lung 9 reflects both traditional concepts of circulation and modern understanding of vascular and mechanical regulation. This is just one example of the anatomy we explore. If you want to study all acupuncture points systematically, deepen your clinical understanding, and earn continuing education credits, the Anatomy of Acupuncture Atlas and the full online course walk you through the entire framework. You'll find the links in the description.